Welcome to the highlights from ASCO GU 2023. I will discuss the highlights for the renal cell carcinoma sessions. In renal cell cancer, there were not many news, but there were a few interesting updates within the metastatic RCC setting. And I would like to start with the first line setting of MRCC. And there was an update for the Checkmate 9ER trial for first-line treatment of a clear cell metastatic renal cell carcinoma. Checkmate 9ER compared the combination of nivolumab and cabozantinib to the, at the time, standard of care sunitinib, and with a primary endpoint of OS, which has already been reported previously, be positive. Now they demonstrated a 3-year follow-up. And so the results are maintained. The combination of nivolumab and cabozantinib improves and significantly improves overall survival over the whole group. Looking at subgroups, especially patients with intermediate and poor risk disease benefit most. And certainly this reinforces that the combination of nivolumab and cabozantinib is another treatment option in the first-line setting for clear cell MRCC. Another update was given for the COSMIC 313 study. First results for this trial were presented at ESMO 2022 last autumn. Now, this was an update looking into subgroup analysis for the risk groups. COSMIC 313 compared a triple regimen of nivolumab, ipilimumab, and cabozantinib to a standard of care of nivolumab plus ipilimumab, including patients with intermediate and high-risk disease. Primary endpoint is progression-free survival, and overall survival is a secondary endpoint. And for the whole group, there is a benefit for the PFS, as has been reported last autumn. However, it was much debated in the community whether this PFS is relevant in view of the increased side effects of triple combination therapy. Now, looking at the subgroup analysis, it's interesting to see that intermediate risk patients clearly have an improved progression-free survival, whereas for the poor risk patients, the PFS is not different between nivo-ipi or the triple combination. And our hope was that especially for the poor risk patients, the triple combination might make a difference. Now, this is not the case, and I think this reinforces our reservation towards the use of a triple combination, at least at the time being and with the results we have. Finally, I would like to discuss the results of CABOPOINT, and CABOPOINT was a trial in the second line or later line setting of metastatic clear cell RCC. In CABOPOINT, patients had received first-line IO-IO or IO-TKI, and then received second-line cabozantinib single-agent treatment. And this trial demonstrated that cabozantinib as a single agent after prior double agent treatment has a good response rate of 25 to 30%. And certainly I think the results of this study show that what we have been doing for a prolonged period of time already, that the use of cabozantinib in the second line setting is a good choice, it's an effective choice, and I think this reinforces what we have been doing. And with this, I'd like to close the RCC session update. Thank you for your attention.